as you just said, the numbers continue to rise in Italy, and the death rate continues to rise. They took radical measures. I mean, the country's on lockdown. Does that indicate that lockdown alone isn't sufficient to control the spread of the virus?
It makes you wonder, doesn't it? Or to what extent they are able to successfully lock down. We'll see. Again, I'm also arguing that it's not just respiratory spread. I think there is a fecal-oral component to this, and that if that's true, then you can think of the areas of the country as being sort of coated in a thin layer of virus. In other words, that as people have this disease, and there is a so-called fecal-oral route that, like polio or norovirus, I mean, it's really hard to get a hold of that. We had a norovirus outbreak on our 5th floor a number of months ago, and it was hard to get a hold of that outbreak, but it did involve a lot of washing of surfaces and making sure careful hand washing in and out. And with that, we got, because of people in our hospital like Julia Salmons, who's just a wonderful infection control practitioner, we were able to get on top of that outbreak. But that outbreak taught me just how hard it is to get a hold of a virus that's transmitted by the fecal-oral route. And I think at some level that may be what's going on in Italy. So if that's true, lockdown doesn't make as much of a difference. And so the way to end that then is to, careful, cleaning of surfaces, constant washing of hands, et cetera. Because if lockdown doesn't stop that's what makes you wonder about that possibility.